slides with you. So an evidence gap map is based on a systematic search to identify and categorize all of the relevant evidence in a given thematic area. So the key things to think in terms of an evidence gap map that differentiate it from a literature review is that it will be based on a systematic search that's defined before you start, a very detailed search process, and then a systematic screening to make sure that you're capturing all of the relevant evidence that fits your criteria for what you're going to include. And then the findings are visualized in an interactive map to enable other users to quickly identify the studies that are of most relevance to their work. So like I said, this will cover an entire thematic area. So for example, we are looking at interventions to prevent violent conflict and atrocities. There are lots and lots of different ways that you can do this. And for the EGM, you'll be able to say, okay, I'm interested in this approach. You can see if there's any evidence related to that approach. You can see what outcomes it presents findings for. And that will hopefully allow you to identify the most relevant evidence for your purpose. Next slide. So our evidence and gap map on conflict and atrocity prevention is going to look for a wide range of different approaches that prevent atrocities and violent conflict. What's interesting here is that we're not just looking at traditional development approaches, like your sort of standard development and peace-building interventions, but we're also looking at approaches such as diplomacy and international human rights law and other mechanisms that the international community writ large has at its disposal in order to hopefully prevent violence and atrocities. So we're going to be looking at including in this map a large range of evidence on effectiveness. So that's both kind of the quantitative impact evaluations that attribute how a particular program or intervention has led to an outcome of interest. So these studies will say exactly to what extent an observed change was caused by the program or intervention. And we're also going to be including more qualitative studies on contribution to outcomes. So those are studies that say we can't specify exactly what amount of the change was as a result of our intervention, but we can say that we have contributed to the outcome that we've observed in these ways. We're going, as well as mapping the evidence, we're going to include confidence assessments of each study, and that will help you best use the study findings in your program and policy decision making. So what that means is we understand that not all evidence is created equal. There's high quality evaluations, there are low quality evaluations, and everything in between. And so we're going to be assessing our confidence in each of these studies using different tools that are specified for different types of research. And the one that we're going to talk about today is the tool that we're working on to assess the quality of case-based and qualitative evidence. Finally, we're going to present everything into an interactive evidence and gap map so that hopefully by August, you'll be able to access this map and access a wide range of evidence on what works and doesn't work to prevent violent conflicts and atrocities. Next slide. So this gives you just a very quick overview of the types of interventions and activities that we're including and the different outcome areas that we're looking at. So the final evidence and gap map will look like this, but with more detail. For each of these categories, there will be a number of specific interventions on the left and outcomes at the top. And for each box in the matrix, you'll see a bubble that if you click, you'll be able to access the studies that report for that type of program and that type of outcome. So that's what it's going to look like in the end. I will now, with apologies for the very rapid overview that I've just given you, hand to Hikari to talk you through the qualitative evaluation appraisal tool.
Yes, thank you, Ada. Can you hear me okay now? I assume so. Yes, thank you. So I'm going to introduce our qualitative evaluation assessment tool we have developed. Next slide, please. So I'm going to talk about a bit of background. Typically, in evidence gap maps, we typically focus on quantitative impact evaluations that use larger approaches, such as experimental design or quasi-experimental study design. But the larger approaches are not always feasible, depending on the nature and the scale of the program, especially, for example, when the program's objective is to, say, to change policy within the country, and therefore the target is just a single country or single institution. This is exactly the case with the evidence gap map we are currently working on. A considerable proportion of evidence base for conflict prevention and atrocity prevention interventions is qualitative studies that use small N approaches, and many of them are case-based studies. So because of this prevalence of qualitative evaluations, we decided to include credible qualitative studies in our EGM, because we want to include as many relevant and credible papers as we can. But the challenge here is, how can we measure the strength of causal claims in small N evaluations? And how can we identify credible qualitative evaluations that the policymakers would find useful? There are actually some tools proposed by different organizations to measure the quality of qualitative evidence, but they often don't consider the strength and confidence in the causal claims. So this is why we have developed our own assessment tool based on the best common practices in meta-evaluation. I'm going to present the tool shortly, but basically our tool comprises 7 assessment criteria or signaling questions to assess some of the key aspects of evaluation methodologies. These questions are made to be clear and concise in order to help systematic assessment and also to minimize the risk of making subjective judgment as much as possible. And the user of the tool don't need to be an expert of qualitative methods. Next slide. So this is our assessment tool. As I said earlier, there are 7 criteria and associated signaling questions. The first criterion is on study design, and the signaling question asks whether the study uses an established small N approach to evaluate effectiveness of the intervention, for example, contribution analysis and process tracing. The second one is on the theory-based approach, whether the analysis is based on an explicit theory of change or a theoretical framework or conceptual framework. The third one is on data collection method, whether the data collection method is clearly described, for example, key informant interview, focus group discussion, or document review. The fourth one is about the data analysis process. So this is about whether the procedural steps for data analysis are clearly described. For example, whether the study includes presentation of a coding tool. The fifth one is selection of cases. So it asks whether the sample selection or case selection strategy is explained and justified. The sixth one is on analysis. So this criterion particularly looks at whether the triangulation was done and whether it is clear how the triangulation was done. And the last one is on bias. So whether the potential source of bias are addressed, for example, by exploring alternative explanations for the results. So each item will be scored as either high, medium, or low. And we do have clear decision rules for scoring, but we don't present them here because it would be a bit difficult to read in this slide, but we will explain them later shortly. Next slide. This slide is just to show what sort of findings you can get from the tool. So the tool we are using today in this workshop is actually derived from another study where my colleagues and I assessed a series of qualitative studies. So in that study, we developed a quite complex appraisal tool for qualitative studies. And this table is just a part of our summary table of the assessment results using that tool. So for each study and for each evaluation criterion, we rated high, medium, or low confidence level. And based on some decision rules, we also rated study level, paper level, overall confidence. So today's tool is a sort of simplified version of this tool that we used in a previous study. But this table is just to show, like, we have already applied a version of this tool to a previous study, which is forthcoming. So the advantage of the tool is, so if you look at the table vertically, you can tell which study is more credible than others. And if you look at horizontally, you can identify sort of common strengths and weaknesses of a series of studies. Next slide, please. So we're going to have
Yes. Hikari, before we get into the breakouts and the specifics, can we just take a chance to ask if there are any questions that anybody has on the tools or the different areas that Hikari has just explained?
Mm-hmm. Yeah, I'm happy to answer if you have questions, but I think many of your questions will come when you actually apply the tool to the actual study. So I'm not sure, but I'm happy to answer any questions you have. I don't see any question in the chat box. Shall I continue?
Yeah, thanks, Hikari.
Yeah, thank you for the suggestion. So in the group session, we're going to apply the tool to one qualitative study as an example, which is done by Sobo. Not sure about my pronunciation. So this is an evaluation on Norway's peace efforts in Sri Lanka from 1997 to 2009, when the country Sri Lanka was experiencing protracted conflicts. So this study evaluates various supports provided by Norway during this period, but the main objective was peaceful resolution of the conflict through peace talks and ceasefire agreement. Yes, thank you, Nick, for providing the link. So you can go to the link, hopefully. So please let me know if you don't have access to the paper. Next slide, please. So before starting the group discussion, I'm going to quickly show an example of how to answer the first assessment question. So the first question is about study design, and it asks, does the study use an established small n approach to evaluate effectiveness? So the answer could be high if the study names an approach and also presents clear description of the analytical process, the process the researchers actually take. And the answer would be medium if an approach is named, but the study doesn't include a description of analytical process, and low if the study doesn't use any of such an approach, or if the study doesn't clearly say, so if it's clear from the paper. Some examples of small n approaches are given in the notes box. So it could be contribution analysis, process tracing, qualitative comparative analysis, and so on. So in the case of this example study by Sobo, the answer would be low, because as you will see in the paper later, the study doesn't mention any of these approaches in the methodology section. So this one, in this case, it was quite straightforward to answer. When you use the tool, we recommend adding notes to your answer just to explain why you rate it high, medium, or low, ideally with a relevant page number and a quotation of the relevant sentences if this if it's not too long. I see some comment. Oh no, sorry. I think that's it for the introduction to the tool. So for the rest of the tool, it's your turn to work on it. So I'm going to hand over to Nick or Ada to introduce the next session. Thank you.
Thanks, Hikari. I think with a relatively small number of people on the line, as opposed to breaking into two tiny groups, we might actually just try to do this all together. So as Hikari mentioned, for each criterion, we're going to look at the study for the particular area, and we'll give you time to read the relevant section and think about the questions that are on the slide right now, as well as the specific criterion questions. And we'll then have a discussion about what you think the answer should be, the rating, the grade should be for this study. Does that make sense? Any questions? No? Okay.
If I might add something, Ada.
Please.
Researchers, we really like to we have questions about how others who might be more focused on policy like this engage with a tool like this. And so as we go through the items, I'd be really keen to hear any views from the group about the work you do, how you use evidence, and whether a tool like this excites you, you find interesting. I'm really keen to just hear how people have engaged with these kinds of tools in the past. So in addition to going through the tool, please do have that in mind. Thanks.
All right. So for the second criterion, we're going to be looking at the theory, the way that the evaluation, the theory that the evaluation tests, I guess is what I should be saying. So we would expect in a high quality evaluation that there would be an explicit theory of change or theoretical framework that's present with, at least 3 elements in terms of the different types of activities, the way those will lead to different outcomes, and ideally any assumptions that inform whether or not those outcomes may or may not be achieved. So in a medium quality study, we would expect that there's a very simple theory of change, such as an if-then statement, or a theory of change with only two of the types of information described in the right-hand column. And then finally, a lower quality or a lower confidence evaluation would not include a theory of change or theoretical framework. It might, however, reference relevant theories from the literature, but it doesn't contextualize these or say what's most relevant for the program that this is evaluating. And it's important to note here that this is distinct from a different type of qualitative research. Because this is evaluations that we are looking at, we always know that there is a program, a policy, there is an evaluand, there is something we are evaluating, and we want to see an explicit theoretical framework or theory of change for why we think this particular activity that's being evaluated is going to lead to the outcomes, the change that we're looking for. So Nick has helpfully put the pages that you should look at in the chat box. Please have a look, and I'll give everyone a couple minutes to read through the methods section, and then we'll start asking what your thoughts are. And if you have any questions, comments to Nick's, or any responses to the question that Nick posed, please let us know in the meantime.
This is page 9 through 12 of the actual page numbers, not what the PDF viewer shows on the left.
Thank you. That is correct. If you click from the document, that when it opens in your browser, you should be able to click the introduction link, and that will drop you down to page number, it'll drop you most of the way there to page number 3, and then you can just scroll down to page number 9.
Yeah, I think it starts at page number 9 is page 31, I think.
I don't know what we're doing.
Sorry, Valerie, I think you might have joined late. So we're looking at the pages 9 to 11 of the linked paper, sorry, 9 to 12, the linked paper that's in the chat. And
Can you repost it? Because I think since I joined late, I don't have the link.
okay. Yep.
Thank you.
So we've got this tool that is in draft that we're testing out today with you, where we're looking at different aspects of what makes for a high quality qualitative evaluation or a case-based evaluation. And so we're going criterion by criterion and looking at the example study that Nick's just posted the link for, And then we're going to have a conversation in about a minute to talk through what people think the answer for this criterion should be for this study. Does that
Perfect.
make
Thank you.
sense?
Yeah, great. Thanks.
We're not going to go through every single criteria, I should say, given time, but we wanted to go through a couple so that you got a sense of it, of how the tool works, and then we'll move towards a discussion. Nathan, you've got your hand up.
Yeah, hey, thanks guys. This is great. Unfortunately, I have to drop off to go to a dentist appointment. But I just want to make sure before I go, I understand next steps. Are you going to be publishing a kind of meta-analysis against your criterion of these various past qualitative studies that is something that we could access? Is that something coming down the pipe?
So that's a great question. So we're going to be publishing an evidence and gap map. And that's what we're using this tool to assess the studies that are included in that evidence and gap map. And so the findings from the assessments will be included in the report. And when you click on a study in the evidence and gap map, you'll be able to see our quality assessment. And you'll be able to see in the report the kind of detailed methodology that we use to reach that assessment and how we went through to develop the evidence and gap map itself. So yes, that will be published. All of the tools will be published. And those should all be done by sometime in August.
If I drop my email in here, is that something you could share?
Absolutely. Yeah.
Okay, thanks. I'm sorry I have to run.
No worries. I hope things go well at the dentist.
Thank you.
Thanks, Nathan.
Take care. So for everyone else, let's start talking about this theory piece. Does anybody want to raise their hand and give a suggestion for whether they think this evaluation should be high, medium, or low for this criterion?
Okay, as being pretty ignorant in this field, I'll stick my neck out because nobody else is, and I don't really care if you chop my head off.
I promise we won't.
On page 11, it talks about the identification of turning points central to our approach. And so while that might not be a official formal theory of change, I think that it might be relevant. So maybe kind of low, medium.
Yeah, that's a great start. Does anybody have anything to add to that? Any other ideas? But thank you so much, Sean, for coming out with this. You both looked through and thought, okay, it's not super clear, but you think you can sort of see where they're going with that. Maybe for this one, Nick, do you want to click the button? So we set this as low. While you're correct in that there are some kind of key points that they flag that might be relevant, those key points were points in time and sort of events that were not directly relevant. They weren't
Not a theory, right?
Exactly. They weren't sort of in a causal chain in terms of the Norwegian support was funding this type of activity, that type of activity had this impact. So they're very useful, if you can think of this more as a process evaluation for understanding why things happened the way they did. Those types of key points are really useful, turning points, but they might inform your theory of change in terms of, if you're trying to refine your theory afterwards, saying, all right, well, this happened and it had this effect, so I need to incorporate space for that kind of effect within my theory. But there's no theory of change or theoretical framework within this study of what types of outcomes they were expecting to achieve and what ones they were going to be evaluating specifically. Does that make sense? Any questions on that? And feel free to disagree with us, to push back. This was just from an initial coding of this study. So for the actual evidence and gap map for each study, we'll be doing double coding. So there will be 2 people conducting this analysis, and any differences of opinion will be reconciled. So that will make it a more rigorous process, whereas this was just one done for the purposes of this event, as we're still conducting our search for the full EGM.
Should say as well, John, that it's often the case that researchers fight till the early hours of whether something should be coded one way or another. And so we fully expect to have lots of disagreements about the application of this tool in our study. Should we move on to the next one?
Yeah, thanks, Nick.
Do you want to go ahead? So the next item in the list that we have is around data collection. The reason that this is important for us is that we as researchers want to know how information was collected, what the processes were, so we can be super clear in our map about that, and people can use that to determine whether they think there's bias that might be present in the process. For example, it might be the case that interviews were done qualitatively, but you don't know if they were a structured interview, so they had questions that they said word for word, or if they were unstructured, so the interviewer was led by the interviewee. And there are substantive differences there that would lead to potential biases. And the same is true for other types of data collection methods. So what we're really looking for here is a clear description of, who the population of interest is. So who are they trying to elicit views from? How they collected those views, when, what kind of tool did they use? And we would be looking for that in the methods section. And so the same kind of page reference applies, page 9 or page 31 PDF page numbering. And I'll give everyone a couple of minutes just to sort of have a look through, see what they think. And coming back to my original point, I'd be really curious or keen to understand if collecting and using this type of information is helpful for when you engage with studies. Any anecdotes or reflections on that would also be really great to hear. But I'll give you all a couple of minutes now. That is a great point, Valerie. Often in an ideal world, we would have access to the data collection tools. Some journals and authors are really great at appending their data collection tools. And in fact, when we work with the UK government, and in particular, the Foreign Commonwealth and Development Office, FCDO, their peer review process requires all of the data collection tools to be appended to all publications. Some journals don't require this, which makes our job as kind of brokers of evidence quite difficult. But yeah, exactly right. Ada,
Can I just add to that, though? This is a fundamental challenge with using research that others have generated, and sort of a point on this tool that we're presenting now and that we're talking through is this is very much done for the purposes of the evidence and gap map, where the focus is to make sure that users of the studies that we're including in our evidence and gap map understand how confident or not confident we are in what they're reporting. And so while you're correct that if we were simply doing a quality assessment of a particular piece of research, as Nick was saying, for example, to get it published in a journal, or, if this is part of an academic exercise, we would have access to absolutely everything they did. We could ask them every question that we had and get clarifications. And it's likely that so many more of our questions would actually be answered and many more studies would have higher ratings. But when that's not made clear in a report, we as the readers of a published piece of work can't assume that if they haven't said that they, for example, carried out these types of data collection methods with these types of population groups, we can't just assume that they've done that. We need people to tell us what they did, because that gives us higher confidence that their findings are based on rigorous research. You know, I'm always cognizant of the fact that many times when we produce a report, it's many pages long in the methodology section, and not many people are going to read that. I'm one of those methods nerds who's very much going to read all of that, because I want to know how those conclusions have been reached, what risks of bias there might be. But a tool such as this will hopefully mean that other people don't have to do that. So if we've gone through and assessed the methodological quality for you and said, okay, we have these types of concerns about this study and these things were done really well, that hopefully allows other users of the evidence that's present in the evidence and gap map to more quickly get a, kind of gut check of whether they should rely on these findings, whether they should take them with a grain of salt, or whether they should be very skeptical. Does that make sense?
So in the interests of time, we felt that the paper, all things considered, did do a reasonable job of talking about how they collected the data. In particular, they were quite clear about who they spoke to, and also importantly, who they tried to speak to and failed to do so. And on page 11, it kind of lists out the data sources that they tried to get through the study. I'd be keen to hear if anyone had any other views on that, or whether they had any reflections on how useful this is to know when you're engaging with evidence. Or if because our theory here is that challenges in engaging in how good a study is prevents people from using evidence. And if you have any views on that as an idea, I'd also be keen to hear them.
So they in the report they call out that the Sri Lankan government refused permission to the team to interview people that there, which is reality.
Yeah.
But how do you account for exceptions? Overall, they were doing the right thing. They did their best to work around the problem, but there was kind of this exceptional case.
Yeah, that's a really great question. And Hikari alluded to this earlier. And Hikari, I'll bring you in a second. But behind each of the questions are a set of criteria that we have developed, such that we can go in and consider, boundary cases, gray cases, and ultimately reach a consistent conclusion. Hikari, I don't know if you just want to quickly speak to that for a minute or so, or perhaps reference some of the decisions you made on the previous study you mentioned.
Yeah, this is I'm struggling to answer the question, because none of the, well, this is why we wanted to hear your opinions about that. So yeah, I don't really have a clear answer to that. So
why don't we go to Valerie's got her hand up first, and then we'll come back to you, Hikari.
Yeah, one thing I can say that if some people refuse to answer the interview, to join the interview or things like that, in some cases evaluators look for alternative sources, and they try to do their best as best as they can. So in that case, it's a bit, yeah, bit difficult decision to make, but if they try to do their best, I would like yeah, I would like take it like a favorable way, if that makes sense.
Yeah, thanks. Nick, do you want to jump ahead to the bias slide? Because I think that gets at this point. So one of the criteria is the risks of bias, the potential sources of bias. And you can think that if you're not able to speak to relevant stakeholders, that could bias your findings because you'd be missing those important voices. But as Hikari says, the sort of paramount guiding principle here is transparency. And if it's clear that they've tried to do, if they're cognizant of their biases, if they report them, the limitations of their study based on any limitations that they faced and what that means for how people should use their effects, then we wouldn't be knocking it in the qualitative assessment. Valerie, do you want to come in?
Yeah, I was just thinking like back to sort of the data methodologies and trying to kind of determine how stuff was collected, you know, and you make some great points about the methodology. I think because I work so much in the USAID space, and a lot of times they just don't want that level of detail in the reports. And so sometimes it gets shoved into an annex or it kind of gets glossed over. I think a big issue can be, I operate in a lot of contexts where qualitative data culturally is very hard to gather, especially focus group discussions. And so it's very hard to gauge, even if they do describe who they talked to, just how well it was conducted, unless they get it really into the details in terms of how they did it and the groupings. So I think that can be sometimes a big concern. It's like looking at the, you know, if you know that this is happening in a country that it is very hard to get good facilitators and good data collection that way, that can be something that you think about because you know that there's going to be a lot of bias or everything might have just been conducted in English. And so that's sort of some of the things that I think that can be hard to just see from what gets written up in like a half-page methodology section, unfortunately.
No, it's a good point. And it gets to John's question in the chat as well, in terms of whether there's a need to benchmark at a report level as opposed to at this specific level. And to Nick's very question for this discussion, we want to know, is it useful for readers of evidence to have this type of analysis presented to you? Because when you read a paper, for example, a USAID report, do you just sort of assume, fill in your head that, you know, all of these steps were probably taken, even if they're not reported in the half-page methodology? Or is it useful, you know, we do, yeah, exactly. So we're hoping that, you know, by doing this critical appraisal process, we've got the time to go into the annexes to read through the detail so that then users of the evidence can hopefully just look at the outcomes of a quality assessment and use that to inform how they interpret the findings. And then the challenge is like, there's a lot of research, there's not a lot, there's a body of research that has looked into these types of tools. Thanks, Nick. That has suggested that, you know, simply giving a weight to each of the specific criteria in our tool and then adding up a score based on those weights is in and of itself actually a biased way of assessing the quality, because these are designed to be fairly straightforward criteria and areas. There's quite a large range of evidence and of answers that you can get in determining a high, medium, or low grade, even at this specific criteria level. And so then to bundle it all up into a single thing is in and of itself biased. So our preference would then be not to give the summary high, medium, or low for each study, but instead to present for each study this type of broken down assessment. Our expectation, though, is that's less useful to busy users who may not have the time to understand what those means and that the desire is for that summary assessment. So I'm very keen to hear the thoughts.
So my thoughts simply looking at this, and I totally get what you mean about how rolling it up doesn't necessarily help, right? I'm wondering if for like the general user, right? Like I come from a male background, so I'll look at it from that standpoint. But for those who don't, I think they need to understand basically. So looking at this example, you have design low, theory low, data collection method high, all of these. What is the effect of those grades on what you can and cannot rely on in the study, right? So what does it mean to me if I have a study that has high reliability data collection method, but a low designer theory? Like, what are the use cases that I should be careful about? What are the use cases that is probably okay, right? Like maybe if I can get access to that data because it's in the DDL, I can do my own analysis on it, right? And it would be reliable. But I shouldn't necessarily assume that the causal mechanisms have been proven because they're not really laid out, right? Or I guess, maybe interpreting for them what that like a low score in design would be like, this wouldn't affect these parts of the use cases, but you would want to be careful using it in this way, etc.
Thanks. Anybody else want to come in on that question? The higher level, is this useful question?
Just one comment. As kind of a general user, I'm looking at the slide you're showing now, where at number 7, bias is high. I wonder if this is a nitpick, whether it might be better to name that factor as lack of bias, or vice versa, right? Because the way it says now, it says, oh, it's got a high bias. So why is that green? Anyway,
That's a great suggestion.
Just an observation.
No, that's a good suggestion, and we can absolutely take that on board. I think it's a great idea. I guess, Valerie, to your response, my concern would be that to properly answer that question in terms of, specifically what it means when design is low, do you think it would be helpful to have a sort of one-page summary on how to interpret the findings from this tool that gives that kind of explanation kind of at an overall perspective, in the sense of we wouldn't be able to do it for each specific study, partially because I just don't think users would necessarily read through that for each individual study, although if you think differently, let me know. I think even just asking people to sort of consider the different ranges of factors that feed into whether a study is higher, medium, or low quality in terms of competence has an effect. You're sort of getting at the fundamental challenge of this, which is, we want to understand, so what does this mean? What does this mean for my decision making? And the challenge is that it almost always depends. And the goal of the tool is to push people to engage critically with the evidence so that they think critically about whether or not they use it. And I'm hoping that, if they've looked at this and said, okay, design and theory are low, but the data collection was pretty good, the analysis process was decent, and the data collection method was really good, the data analysis and selection of cases, descriptions were medium, and the final analysis of the evidence was high, and there's a low risk of bias. Broadly, that means they can probably be confident in the study's findings, but the study's probably not going to contribute much to what that means in other cases. So we could say something like, low theory means that this study might have internal validity, might be relevant for that specific area, but it's harder to know what that means elsewhere. Would that be helpful?
Yeah, I think so, right? Because everybody's going to have a slightly different use case for how they're using this stuff. So if I'm trying to find studies that support, my theory of change that I'm writing for an activity, and I want to, find evidence that this my assumptions about my causal model are there, I wouldn't use this study. But if I just want to see what has been working in a particular country, and I'm going to go to this country and do this work, this study might be perfectly fine because we know that I'm not trying to generalize it across to a different context. So I think, yeah, I think having some way for them to interpret, because you run the risk if they just say low, like, well, I can't use it for anything. But having a way to say, okay, be careful, extrapolating and generalizing this across all contexts. But if you're working in pretty much the same context, it's a good source of evidence. I think that would be really useful.
That risk is really real. We see studies that end up scoring low ultimately just get discarded sometimes from analysis, which is sometimes the right thing to do, but there's also a risk that it's overly done for the sake of it. And so what you're saying makes a lot of sense.
I wonder if what it means is that the next step for this is to have a set of use cases, of like evidence use cases. And so like for, some given evidence use cases, such as develop a theory of change, we'll say you'll want to look for studies that have high quality theories and maybe analysis, or these are the categories that are most important for this use case, for that use case, for another. Maybe that would be the next step to make this more useful.
Absolutely. I think that would be really helpful for sure.
Hikari, what do you think on that? Do you think that's something we could work on? Appreciating it adds another level.
Mm-hmm.
I was really struck by what you said, Valerie, about the quality of data collection. I think our current item 3 focuses on simply documenting the procedures. And sometimes you do see, and I'll be honest, it's in the qualitative space that people are honest and transparent about the quality of research implementation. I think that's a really interesting point and something that we can reflect on.
Sorry, I was just teasing Nick for being a bit of a quantitative researcher. You can tell from his, I'll be honest, where his biases lie. That's okay. Thank you so much for your contributions, Valerie. That was hugely helpful and we really appreciate it. For everybody else online, we've got another 10 minutes for this session. Are there any other questions? Any other reactions to these questions? Any challenges? Very happy to hear.
I have a question. Can you go back? Can you go back to the comparison of 10 different studies? Yeah, or yeah. I was, as you suggested, I was looking at this both vertically and horizontally. Vertically, you can see that study 1 and 4 stand out as being pretty good if you just want to. If you had your choice of 10 different studies to 2 out of 10 studies to pick, you might well go to studies 1 and 4, and if you had your choice of 8 out of 10 to use for some reason, you might stay away from 10 and 6. I don't know, but that's fine. And I can make a judgment about that kind of decision. But I was looking at horizontally, and some of these areas definitely seem to be weaker than other areas. Do you have any thoughts about why those areas are weaker than others?
So just go ahead, Hikari.
Yes. What we observed is so for this set of studies, we rated low confidence for sampling and especially discussion of bias. The reason behind this, so this set of studies were on the lobby and advocacy program supported by Dutch government, and this is a really large scale program. So each of the study is on the program done by NGO across 30 or 20 or 30 countries. So they had so the sampling process was quite complex, and they didn't have enough space to present the sampling process, and it sounded like it's our conclusion is like evaluators didn't consider this information was really important, while no criteria we think it's important. So I think they did have, the evaluators, they did have sampling strategy and justification, but it's, I think the question of reporting due to lack of space or things like that, and the discussion of bias, because all of the I think the qualitative study, the challenge is to yeah, quite a few study talks about bias, and with qualitative method, it's difficult to reduce the bias. There's no, I don't think there's an established method to reduce bias. So I think these are the reason.
Okay.
Yeah, if that helps.
Yeah, great. Thank you.
I think I interrupted Ada before I started to talk.
No, that was much more helpful than what I was going to say. Just on your last point in terms of transparency, in terms of bias and qualitative studies, I think, or methods in general, being transparent is the most important, both in terms of, transparent of your own background and where you're coming to. So that's where, being transparent and this is what we thought we were going to find, and also being transparent about, what you were and weren't able to do and what implication you think that has. That's the best way to address bias, because that just makes it really easy for any reader to say, okay, I understand what I can and cannot do with this evidence, because it's really clear what it does and doesn't cover and what that means. I think the challenges. Victor, to your question in the chat, can I just check? Do you mean the challenge of gathering evidence on the thematic, like violence and atrocity prevention, or do you mean gathering evidence to assess these different criteria? Feel free to update your question. I'm just not quite sure how to answer it at the moment. So there's a final addition to Hikari's answer to your question, John, is that in the evidence and gap map report, we will be doing some of that kind of trend analysis, looking at the quality of the evidence base and, trying to see if we can see any clear trends, and where possible, doing some additional, literature review to see if there's any theories from the literature about why those trends are present, and or just saying, we've noticed this is a great area for somebody to do some more research into. Right, so on the source of the evidence gathering, evidence in this space is very challenging to get. As you can imagine, it's an incredibly sensitive space. And that's why there is such a high degree of case-based and qualitative evidence compared to some of the other international development writ large fields, particularly compared to more general population health and education, where large-scale studies are very easy and commonplace pretty much globally. And that's why we're trying to make sure that our evidence and gap map is really wide-ranging and addresses or incorporates many different types of evidence. However, we come from a background where we're more used to looking at evidence from a generalizability perspective. What does this mean in other cases or the next time? And that's when these questions around this quality of the methodology that they used become so important. Because, when you're looking at evidence just to see what is happening in a particular policy area, what's being done, it matters less whether or not you can use that evidence in other cases, because you're not looking to see if what's happened previously in one context is applicable somewhere else. And so that's, why I thought Valerie's suggestion of, the discussion we were having about moving towards having some different use cases and the specific criteria that are most important for different use cases is going to be so useful, since it's going to vary a lot what types of evidence are going to be useful for different use cases and which evidence with which weaknesses you can still incorporate or how you can still use them. Does that sort of address those questions? Great. Well, we've got 2 minutes left. If there's any final questions, throw them out. Otherwise, feel free to connect with us through the Zoom platform. We'll be online today and tomorrow, or otherwise I'll put my email in the chat, and anybody who wants to send an email and stay in touch, please go ahead and do so. Love to hear from you. We're very keen for this piece of work to be useful, and therefore it needs to make sense to you, the potential users. Nick or Hikari, any last points that you wanted to add?
Just to echo what you've said, Ada, really keen to design something that's useful for practitioners as well as researchers. Try and break out the mold of researchers only speaking to researchers. So thank you so much for your contributions, and we look forward to hearing from you.
Yeah, I just want to thank you everyone for joining and making useful, helpful suggestions to our work. So yes, hopefully we can incorporate your comments to our work, and yeah, thank you.
Great. Well, thanks everybody so much. That's us wrapping up on time despite the late start. And sorry again for that late start. We had a very confusing technical challenge to access the room. Thank you for bearing with us, and I hope you all enjoy the rest of your time at PeaceCon.
Thanks, everyone.
Thank you.